Hello, this is Dr. Stanley Lang. Welcome to this broadcast. And the question we're considering today is it Lyme disease? Is it Lyme disease? And the question obviously is dependent on the presentation. But before I tell you the presentation, I just want to give you context. The videos that I create are made with a whole person health approach in mind, health of body, mind, and spirit, which I think is where the best of health lies. But today we're focusing primarily on the physical part of that whole person triangle. And I saw a patient today who is in her mid-20s. She has been very healthy, no major medical problems her whole life. Until very recently, I saw her, she was having some knee pain. She thought maybe was related to too much bending at work. She had to do a lot of lifting. But now I saw her back a month later, and her ankles are hurting, her knees, her hips are hurting, and even her hands are starting to hurt. And also some of the joints in her fingers, they feel like maybe they're swelling a little bit. Now, she doesn't have any of the usual symptoms of an inflammatory arthritis, but this could be early rheumatoid arthritis or some other disease where the immune system is attacking the body. But on the other hand, it could be Lyme disease. And why do I say that? Well, partly because I've seen a lot of cases just like this that turned out to be Lyme disease, even though the blood test was negative. So how do I know it was Lyme disease? Well, unfortunately, I can't say with 100% certainty because there is no confirmatory test available in the United States for the average clinician like me. So if the Lyme test is negative, what do you do? Well, for most doctors, they're trained to not do anything, that if the test is negative, the patient doesn't have Lyme disease. And for most people, they are only treated for about 3 weeks of antibiotic therapy. In my experience, 3 weeks of antibiotic therapy is far too short for somebody with chronic Lyme disease. Now, there's basically two different versions of Lyme disease, acute and chronic. And then under the chronic banner, you could describe a lot of different types of that presentation. Acute Lyme disease would be like if you got bit by a tick and within 3 days you're starting to get symptoms and you started antibiotic treatment, almost 100% of the time, if not 100% of the time, 10 days of treatment will cure that. But if you miss the initial infection and the germ gets in the body, and it sort of goes undercover, so to speak. At that point, the infection, when it rises up again and the body is aware that there's something going on, that's chronic Lyme disease. That can happen days, weeks, months, or years after the initial infection. Chronic Lyme disease takes many months of treatment to control, and many of the times it doesn't get cured. Now, one of the reasons it doesn't get cured is because the organism is capable of changing from its active infection form into a form that evades the immune system. And this form can also group together and actually form colonies and create a substance that actually makes it impervious to most of the antibiotics. So that's one of the reasons why people don't get over Lyme disease, even with a long course of treatment, much of the time. So this patient, I think, probably does have Lyme disease. And so I offered her the option. I said, I can send you to a rheumatologist who can do the evaluation and look at all the different conditions that could be going on, do all of the blood work to look for these different diseases, or we can just start a trial of treatment of antibiotic therapy on the presumption of Lyme disease. She chose the latter approach, and I often do use antibiotics for this sort of a trial. Now, if I see significant improvement in 3 weeks, I'm very, very suspicious at that point that this person has Lyme disease. Now, fortunately, we've developed a natural treatment for Lyme disease that doesn't require the long-term strategy of antibiotic therapy, and it's proving to be very, very effective. And so if you think that you might have Lyme disease or you know somebody who might, you can click on the link below this video or maybe above it, depending on where the video is being seen, or maybe actually on the video. to take a survey to see if you might have Lyme disease. And if you think you might, you can have access to a very simple course that will show you how to use natural strategies to overcome the Lyme disease. So I wish you well with this. If you're dealing with any of these symptoms, I know that can be very frustrating, and I wish that I wish you well and that you have full recovery of whatever you're dealing with. God bless and have a great day.